It was a mess.
You've been involved in some real class stuff.
Welcome back. Oh, welcome to our program. Well, it's my mic, isn't it? Yeah. All right. There, it's there somewhere. There it is. Welcome to our program here on Coastal Daybreak with Sugar Talk with Dr. KG Lucas, and Dr. Lucas is in the house. Good morning, Doctor.
Good morning.
What are we talking about today?
Gastroparesis.
We've had this subject before, I believe, and you explained it, and you'll need to explain it again.
Right. Can you spell it yet? Have you
I
learned
can
how
when
to
I look
spell
at my
it?
notes. I think I could probably do it.
Well, it's either gastroparesis or gastroparesis, whichever you prefer.
Yes, I prefer the paresis.
Yeah,
I don't know
paresis.
why, but it
Yeah,
just sounds better.
gastroparesis sounds better.
Okay,
Anyway.
but it's the stomach emptying.
Yeah, it's paralysis of the stomach. So gastro is stomach and paresis is paralysis or slowing down or not moving correctly. And it's a disease that comes along with diabetes. It's nerve damage to the stomach.
Is this a common disorder?
No, it's not that common, thank goodness. But people may not be aware they have it. Usually it happens after eating. You'll feel bloated and full because food stays in your stomach. And sometimes it can stay in there, for 8 hours. So you're not ever hungry. You're just full, which may be a good thing for some people. But it can lead to a lot of problems with, if you take medications, like oral medications, they just sort of sit in your stomach. They don't go on through. They're not as effective. You don't feel very good. You throw up a lot. So it's sort of a severe thing. And there's not that many treatments for it. And that's the other problem is there's not too many treatments. And if the treatment's given orally, it may not get absorbed because it's sitting in your stomach for hours. So the main treatment is Reglan or metoclopramide, which is a pill. So you take it. Sometimes the liquid medication works better. But if you have this problem, a lot of medications need to not be given orally. They can be given liquid or patches or injections or some other way to avoid your stomach not being able to move them through.
Is nausea one of the telltale signs of that?
Because if you're full,
And
if
it
the
stays
food
there
is
for a
in
long
there
time.
and then you eat more,
Yeah. Right.
then your stomach isn't like that. It's already full and you're eating more than you should, and you're getting nauseated. It's sort of like the medications for diabetes called GLP-1 drugs, which are like Victoza and Byetta. They slow your stomach down too. So some of the side effects of those are similar to the gastroparesis, is that you get nauseated or have reflux, acid coming up from your stomach because nothing moves
Right,
through, so it moves
right.
back up.
Yeah. Is there other dangers or as a result of having this? I mean, there's things that can be
Mainly, you just don't digest your food properly, and then also if you have diabetes and you're on insulin, then the insulin may not work properly because if you're on short-acting insulin, it works quickly. Well, if you don't empty your food out of your stomach, you don't absorb your food, so your blood sugars can drop. And then when you try to correct the low blood sugar, you don't absorb the orange juice or whatever juice you're drinking as fast, so you don't recover from a low blood sugar. So it leads to a lot of problems with blood sugar regulation, especially if people on pumps or people on shots, on insulin shots, even people on oral agents. It may not help because your blood sugar is just, who knows when you absorb your food. You can absorb your food in the middle of the night, your sugar will be real high, or you could not absorb it at all, it stays low all day. It creates pretty much disaster as far as controlling your blood sugar.
Everybody's felt bloated at one time or another, but this is you're feeling it all the time then, right? Basically.
Yeah, after every meal. Now, some people, what they'll do is they won't eat all day, and they'll just have one meal, and that'll last them all day. And some people do that, or they'll have liquids. Sometimes you'll have liquids in between. So if you know you have it, you can modify the food intake so that you realize how quickly everything goes through. There's a gastric emptying study where you have radioactive eggs, and you eat the radioactive eggs, and they measure the reactivity in your stomach, and they can measure it over 2 hours and see how quickly your stomach empties. And that's one way of deciding if you have this. And they'll say, well, only 10% went out in 2 hours. That means 100% is going to go out in 18 hours.
But if you have this and you're diabetic, then that's particularly dangerous.
Right. I mean, the blood sugar issue. Now, people can have gastroparesis and not have diabetes. Pain medications slow down your stomach. Everybody knows about pain medications causing constipation, but they also paralyze your stomach, so you don't move anything through. It paralyzes your whole GI tract, all your intestines and your everything in there. So we have a study, but it's for people with diabetes and gastroparesis. And one of the things is you can't be on opiates or pain medications because that slows down your stomach too. The study we have is a shot, and it makes some sense to give an injection for gastroparesis because if you take an oral medicine, it may not work.
It may not go
So
anywhere.
the more medicines you can take with injections, the better, or with patches or with creams, or even grinding them up and putting them on liquid. Liquid medications would work better with somebody with gastroparesis. So the study is interesting because the placebo effect is about 80%. That means
really?
that just the fact that you give a shot helps your stomach.
Huh.
Which
Is that
it's
your
hard to
stomach
prove
reacting
that the
to
stomach is, I mean, it's hard to prove that medicine is really working. If you have a high placebo effect. So the studies in the past with the same medication, everybody seemed to get better, whether they were on the medicine or not. So that was pretty interesting, actually.
Yeah.
Because you have to stop.
You have to ask what is your stomach doing? Is that reacting to having
Your
a
brain
shot period?
thinks the brain helps. The brain is helping your stomach.
Because you're telling it it's going to work.
Yeah, I don't know how placebo effect works, but it's pretty much your brain being convinced that something's helping. So even if, because for this study you have to be off the Reglan, you have to be off your medications that's helping your stomach. So some people are not able to do that because they get so nauseated. So what we try to do is give them liquid food in between solid, maybe have one solid meal, depending on how slow their stomach empties. And for this study, they actually do a green eggs meal with crackers, and the green eggs have algae, and the algae emits carbon dioxide, and you measure that, so it's a breath test to see if the algae's still in there.
You don't mix a little ham with that too, do you?
No green eggs and ham, just green eggs and crackers.
Okay, all right. I thought it would just be a good literary move. We'll find out more about this, and also if you may qualify as well. How do you find out if you qualify? When we come back in a moment here on Coastal Daybreak here on the Talk Station, FM 107 and AM 1240. Hope you'll stay with us.